Another absolute indication of recurrent balanopostite. Just one episode of balanopostite is not foreign or circumcision. Recurrent balanopostite. Balanitis means infection in the glans means. Postitis means infection in the post. Balanopostite is infection of both. Right? So recurrent balanopostite is again another indication. Tight phimosis. Pinhole metastasis. That's also. So those are the absolute indications. Relative indications for cultural reasons. Right? Number one. Number two. Anything else? Cultural reasons. Other than that, paraphimosis. It's not an absolute indication. Paraphimosis. Anything else? Children with recurrent UTI with urinary tract anomalies. Children with recurrent UTI with urinary tract anomalies. And another one would be those are the relative indications. This is the surgery where WHO spent largest maximum amount of money. Surgery wise, not LRD, circumcision. Because it is known to reduce STDs. But what are the contraindications for this surgery?
Hypospedia.
Hypospedia. The patient has hypospedia. This surgery is considered because your foreskin is important for your correction of hypospedia. Therefore, it is contraindicated. What is hypospedia?
Pulmonary
Opens at dorsal or ventral?
ventrosum.
Where is the dorsal of the piece? Where is the ventral? You call it in anatomy. Not in flaccid. So its dorsal surface is what is underneath in the flaccid portion. Dorsal vein of the penis is on the front. When the erectional meatus opens onto the ventral surface for hypospedia. So hypospedia can be several grades. It can be glandular, it can be coronal, it can be penile. So it can open at, it can be not at the tip, but in the glans, but little bit below. That is glandular. Coronal means it's at the corona. Penile means it's at the penile shaft. Then it can be scrotal. It can be even perineal. With the severe hypospedia, it looks like ambiguous genitalia. Severe hypospedia. Looks like patient because the phallus is there, but the urethra is in between the two scrotum. Right? So it's just like hypertrophic clitoris with valve. So it looks like ambiguous genitalia. So if the patient hypospedia, you should not do circumcision. Then, what is epispedias?
The dorsum surface.
When it enters dorsum, which is more common. Hypo is way commoner than very low incidence. Epispedias can be associated with what? Bladder exostrophy. If it is very severe, bladder they develop like that. Bladder exostrophy. You get pediatric surgery MCQs. That's why I'm telling these things. So hypospedias, epispedias is another thing. Hypospedias is so those are the implications for circumcision. And when you do this surgery, you have to tell the patient or the parents of the child that this is irreversible procedure. Because some mothers or fathers, doctor appointed the other let's go foreskin transplantation. Okay, you can't do that. So it is irreversible procedure. Once done, it's done. Because some people, because for few days, it's very uncomfortable. Because what is the glands was not exposed initially, now it is exposed. It's sensitive. It touches the underwear. It's very uncomfortable operation. Some people come and request doctor. Don't give hopes. How a donation you there's nothing like that. You can't transplant it. Go on. it's in the basket. But if you do it for foreskin cancer, it's not in the basket, it's in pathology. Another absolute indication, I forgot BXO. Another absolute indication. What is BXO? Balanitis sclerotica obliterans. It's a risk factor for penile cancer. So balanitis sclerotica obliterans is also absolute indication for circumcision. In that case also we send that to history. Suspected penile cancer, foreskin cancer, suspected VXO, we send that to history. Lot of children, we come across lot of male kids, parents says, urine passport or either and ballooning because they have been weight balloons. So those things are common. And it is a physiological thing to have degree of phimosis division, but with time it disappears. There are conservative management, especially for pediatric age group, because we can't you don't have to remove it because one thing is irreversible and foreskin it's a natural thing, you don't have to remove it everyone, so we don't remove it. So there are natural conservative management. Conservative management can be tried. So we just retract the prepuce and see whether it goes down slightly. If it goes down slightly, it pouts. You know what is pouting? You all take selfies. That is pouting. So that is pouting. Similarly, when you retract the prepuce also, it pouts like a rosebud. If it pouts, you can try conservative method. But when you retract, if it does not pout, if it is a pinhole meatus, then there is no place for this local application. So you can try 0.5% to 1% hydrocortisone cream. We advise the mother to retract it and apply the cream once it is pouted at the night. The next day morning, put the proper vipassana. Like this, keep on applying. Right? So sometimes it becomes. We can tell the mother, don't worry, it's a physiological process, with time it will be alright. But if there are any absolute or relative indications, of course you can go for. So circumcision can be surgical, or there are devices to do circumcision. One is plastic. Plastic, you apply, it's a plastic gadget, you apply it and it makes the foreskin ischemic and gangrenous and fall off. I think it's painful. You can ask Leo. I don't know whether it was done in plastic or not. Then what are the complications of circumcision?
Skin granuloma formation,
Skin granuloma formation,
meatus stenosis, formation of urethral fistula,
You are telling the rare shouldn't happen complications.
abdominal rotation,
What do you call it? Cody. Name at the Cody. Any budget pronounce that?
it's another
Common complications?
osmotically fluid.
Common complications for any surgery, what are the common complications? Like side effects,
Bleeding.
nausea, vomiting for any drug except for antibiotics.
Bleeding infection.
Bleeding and infection. Similar, bleeding is common. Bleeding is common. Some, especially in pediatric age group, one of the presentation for bleeding disorder is circumcision. Trauma Olympus circumcision hemophilia. So bleeding is a very common complication. Any other complication? Infection. Bleeding and infection. And the other complications. The complications which should never happen are damage to glands, damage to meatus, which can cause meatal stenosis later. Especially if you are doing it for BXO, you have to tell the patient meatrial stenosis is part of BXO. It's not a complication of your surgery. Because meatrial stenosis comes along with BXO. It is not a complication. Another one is coding. Because if you cut the foreskin excessively and you suture, what is coding? There's angulation of penis on erection. So there are another coding. Coding is one complication. That is if you cut the foreskin excessively. Dan brain stem එක අපතර පෙනවා. Any questions? Arsha, ikut dua pun